Atrial fibrillation is an irregular heartbeat. It affects the small chambers of the heart which wriggle like this, and this wriggling phenomenon risks the development of clot in those chambers. Now on the left side of the heart, those clots can break off and fly into the circulation and create a stroke, and this is one of the biggest risks of atrial fibrillation. And the reason why many patients with atrial fibrillation end up on blood thinners. Now there's an area in the heart called the left atrial appendage, and if you imagine my head is the left atrium, the small chamber on the left side of the heart that's fibrillating, there's a little cat's ear on it, and in there is where blood can swirl and can clot, and it's from there, when people have a stroke in atrial fibrillation, that the clot has come from in 95% of people. Now, if you have got atrial fibrillation and you can take a blood thinner, that's fine. But if you have atrial fibrillation and you cannot take a blood thinner, you're running a really significant risk of having a stroke. And it's in those conditions, in those situations, where we as surgeons can sometimes perform a simple procedure through a telescope that leaves you in hospital just for a day or two, perhaps, to clip this appendage. It's called left atrial appendage clip. We treated a patient recently who had had a brain hemorrhage and could no longer take blood thinners but ran a high risk of stroke, and we clipped that appendage through a small telescopic hole on the left chest in order to sort that out. Now of course, if you're on a blood thinner, then you're likely to be protected from stroke, not entirely necessarily, but relatively so. If on the other hand you have atrial fibrillation and you are not on a blood thinner, then you may need to see your doctor just to check whether you fall into that group of patients who do need a blood thinner to prevent this risk. And of course, if you are at the higher risk group of patients for stroke development and you're not on a blood thinner, it may also be worth speaking to your doctor to see whether or not you should be considered for clipping of the left atrial appendage.